How does colonography compare to a traditional colonoscopy? Imagine a quick, non-invasive scan that can help detect colon issues without the need for sedation or a long procedure. That's what colonography offers, but how does it stack up against the traditional colonoscopy? Both are important tools for colorectal cancer screening, but they approach the job very differently. Traditional colonoscopy involves a doctor inserting a flexible tube with a tiny camera on the end into the rectum and guiding it through the entire colon, which is usually about 5 to 6 feet long. This allows the doctor to see the inside of the colon in real time and even remove polyps or take tissue samples if needed. The procedure typically takes about 45 to 60 minutes and requires sedation, so patients need some recovery time afterward and cannot drive for the rest of the day. On the other hand, colonography, also called virtual colonoscopy, uses a different approach. A small tube is inserted into the rectum to gently inflate the colon with air or carbon dioxide, which helps produce clearer images. The patient then lies inside a low-dose quart scanner that takes hundreds of cross-sectional images of the abdomen. These images are processed by a computer to create a detailed three-dimensional view of the colon's interior, similar to what you'd see during a traditional colonoscopy. This process takes about 15 minutes and does not require sedation. Patients can return to their normal activities immediately afterward, with only some temporary discomfort from the inflation process. When it comes to detecting larger polyps, both methods are quite comparable. Colonography has shown similar sensitivity to traditional colonoscopy for polyps larger than 6 millimeters. However, for very small polyps, traditional colonoscopy tends to be more accurate because it can detect and remove tiny growths that might be missed on a quart scan. Both procedures carry small risks. Traditional colonoscopy has a slight chance of causing a colon perforation or bleeding, especially if polyps are removed. Colonography also has a very low risk of perforation, mainly related to the inflation process. It does involve a small amount of radiation exposure, roughly equivalent to natural background radiation over 2 years, but no radiation remains in the body afterward. In contrast, traditional colonoscopy involves no radiation. A key difference is what happens if polyps or suspicious areas are found. During a colonoscopy, the doctor can remove polyps immediately or take tissue samples for biopsy. This makes it a combined diagnostic and therapeutic procedure. With colonography, if polyps are detected, the patient must undergo a separate colonoscopy to remove or biopsy them, which can add to the overall cost and inconvenience. Another advantage of colonography is that it can sometimes detect abnormalities outside the colon, such as early signs of other cancers or conditions like abdominal aneurysms. Traditional colonoscopy is limited to examining only the colon and rectum. Cost-wise, colonography is generally less expensive than a traditional colonoscopy, making it an attractive option for routine screening in people without symptoms or risk factors. However, if there is a history of polyps or colorectal cancer, or if symptoms like rectal bleeding or persistent pain are present, a traditional colonoscopy is usually preferred because it allows for immediate intervention. Both procedures requiring similar bowel preparation to ensure the colon is clean for optimal visualization. Patients should follow their healthcare provider's instructions carefully. When it comes to patient preferences, many people appreciate the speed and non-invasiveness of colonography. Still, the possibility of needing a follow-up colonoscopy if polyps are found can influence some to choose the traditional method initially. In summary, colonography is a valuable, less invasive screening option, especially for those hesitant about traditional colonoscopy. But for comprehensive examination and immediate treatment, the traditional colonoscopy remains the gold standard. Always consult with a healthcare professional to determine the best screening approach based on your personal health history and risk factors.